Welcome to the PCOS Fertility Health Podcast. I am your host, Dr. Angela Potter. I'm an integrative PCOS fertility doctor and a speaker. I have shared the stage with leaders from companies like Microsoft, Google, and Headspace. And I'm really excited to be on this platform, chatting with you, sharing with you about PCOS and how to improve fertility with PCOS. And if you're a new listener this week, welcome. I am overjoyed to have you here. This is a podcast and this is a community where you are going to understand different misconceptions and problems with the PCOS fertility world, how to navigate those in order to turn around your fertility. Because you're here because you want to get pregnant and you've been trying to get pregnant for the past few years and it just hasn't happened yet. You really want to figure out the root cause of what's keeping you from getting pregnant. You don't want to just throw fertility medications at your picture, and you really want to optimize your health to understand why you haven't gotten pregnant yet. Because you've been told also that your labs are fine. And yet they say we can't do anything for you. You're just going to have to move forward with IVF in order to get pregnant. And you're thinking 2 + 2 should equal 4, right? Like if my labs are fine, why am I not pregnant yet? And so if that's you, you are in exactly the right place. And be sure to come join me over on Instagram at Dr. Angela Potter. We have so much fun over there, and I share even more about the PCOS fertility journey, tips, tricks, recipes, misconceptions, problems, how to get answers, all the things. So join me over on Instagram. And I want to acknowledge you for showing up here today, because that shows your dedication to your health and to your future family. And even though you've been trying to get pregnant for the past few years, you are committed to understanding why you haven't gotten pregnant yet. And you are holding on to that hope, knowing that at some point you will get those answers to understand why you haven't gotten pregnant and what you can do in order to turn that around. And that speaks very highly of who you are as a person. And I think it is just so cool that you are here. Today we are talking about the common timeline for fertility and really why I see this as a reactive timeline rather than a proactive timeline. Right now in the fertility world, it is recommended that a couple who is 35 years or younger try to conceive naturally for 1 year before going to see their PCP or their OB or fertility specialist for help. For anyone who is 35 and older, it's recommended that they try to get pregnant naturally for 6 months before going to see the doctor or a fertility specialist. Everyone wants you to get pregnant, right? And we believe that the body has that ability because we know women are getting pregnant. Well, that timeline is set up because the medical world is like, one, we don't want to give anything that's excessive or unnecessary, which makes sense. And then two, we just want to see if you can get pregnant naturally, because we know, yes, even though it's difficult for some women, there are plenty of women out there with PCOS who can get pregnant. And so the medical community is like, you just try by yourself and then come to see us after 1 year or 6 months. But this, from my perspective as an integrative doctor, is a reactive type of fertility plan. Here's why. Number one is that for women like yourself with PCOS, you already have certain hormone issues, nutrient deficiencies, egg quality concerns that are creating this difficulty in getting pregnant. And so when you already know that you have PCOS and a doctor is telling you, well, all right, you've got PCOS, but just go try for a year and then come back and see me after 1 year. You're like, what? Like, yes, of course, I'm hoping that I get pregnant naturally, but how can that happen if you're already having irregular periods and you know there's other symptoms going on? Maybe you do get big blood sugar swings, things like that that are happening that you want to get taken care of. And the second reason that that kind of a timeline is reactive is because what's happening is that the community, the doctors that are following that timeline are saying, well, you haven't gotten pregnant in this last year. All right, we are putting the pedal to the metal and let's get you on these fertility medications and giving you round after round of fertility medications. If those don't work, then moving you forward straight to IVF. That is basically just saying, hey, we don't believe in the power of nutrition and really creating this nourishing food plan for your body as you're trying to conceive. Preconception health isn't really important here. You've been trying for a year, and the only thing that we're going to do for you is to just jump you on this conveyor belt of moving you forward medication by medication, seeing if that works. So these medications are being used in a reactive way of, oh, you haven't gotten pregnant yet. We just have to jump you on these medications and jumpstart this process. The opposite, that proactive fertility plan, is the type of fertility plan that I utilize in my practice. That is a plan that doesn't wait for you to be on that 1-year timeline. It says, okay, where are you right now? Are you diagnosed with PCOS? Okay, if you are and you want to get pregnant, these are the different pillars that we need to set up in your fertility plan. We need to identify what certain things are causing you to have these hormonal issues, egg quality issues, nutrient deficiency issues. We have to identify that. And then we have to move you forward on this nourishing fertility plan that creates this fertile abundance in your body. That kind of a proactive plan knows the power of nutrition, knows that that is one pillar that needs to get set up for fertility. We have got to create a nourishing nutrition plan in place so that your body is getting the nutrients that it needs, the fats, the proteins, the nutrients, all of these things that the power of food has in this way that sets you up for optimal fertility health. Proactive fertility health is looking at your body from this holistic whole body experience and understanding that it's not just about your ovaries. It is not just about your reproductive hormones. It is about, we've got to take a look at your gut health. We've got to look at other hormone patterns and how they are affecting your fertility. We've got to look at your eggs. Do you have egg quality that is setting you up for fertile success? A proactive plan like this takes you from being in this place of not understanding what your body is doing, feeling very uncertain about why your body is broken, and moves you to a place where you have those foundations in place. You know how to support your body. You have an egg quality plan in place. You have a clear picture of what your hormones are doing on a monthly basis and what these other hormones are doing that are impacting your fertility hormones. And you have got a plan to address those things. This proactive plan is a guide. It is a roadmap to get you from where you are in order to get you to where you want to go. A proactive fertility plan is one that addresses your individualized needs. And when it comes to PCOS, individualized needs is key to opening up fertility. You do not fit into a one-size-fits-all box. And we should not expect that your fertility plan should fit into that box as well. And that's what that reactive fertility plan is assuming. It's assuming that we have one medication, one path forward that addresses everything that is coming up with PCOS. And we're finding that that just doesn't work. And so when you have a proactive fertility plan, one that is addressing all these other issues with PCOS, how they're setting you up for not getting pregnant, And looking at your body's individualized needs and addressing those concerns, that's when fertility starts opening up. So when you're here and you are looking for the root cause of your fertility struggles and you want to understand why you haven't gotten pregnant, even though you've been told that your labs are fine and you could just go move forward with IVF to get pregnant, you really want to take that time to optimize your health before even having that conversation of potentially trying fertility medications or procedures like IVF. You want to get to that root cause of understanding what's keeping you from getting pregnant and how do you get there? How do you turn things around in order to get there? That proactive fertility plan is that step to turning things around. And you can ask yourself, one, do you want to move forward with a plan that addresses your fertility struggles with medication after medication, trying a few rounds to see if they work, and then if they don't work, moving forward to IVF. If that feels right to you uncovering the root cause of your fertility struggles, or moving forward with a plan that sets you up for fertile abundance in your body with nutrition and egg quality nutrients, antioxidants, with balancing out hormones and seeing where that takes you before having that conversation about medications or procedures. If you want to talk about what that proactive fertility plan looks like for your specific situation, jump on a free PCOS Fertility Breakthrough Session with me. That is when you and I are going to jump on the phone, talk about your specific fertility journey, what's been missing, what's been keeping you from getting pregnant, and I'll help you get clarity on how you can move forward in order to turn that around and have the best chance at getting pregnant with PCOS. Just a quick note about my calendar this week. There are very few of those spots available. So if you jump over to that calendar, which you can find at drangelapotter.com/PCOS, and you don't see any time slots available, wait a few days because my calendar opens up every 4 days. And so come back the next day or the day after that, and you should see spots opening up. But those have become even more popular. And so if you want one of those, be sure to grab a spot when you see one open on the calendar, okay? Just a reminder that this podcast is for informational purposes only and is not meant for specific information for your needs. The only way to understand what's most important for your fertility journey is to talk with me one-on-one. And if no one else has told you this today, I want to be the one to tell you that I believe in you and I believe in your ability to turn around your fertility journey and have the very best chance at getting pregnant with PCOS.